Hi, I'm Dr. Mickey Karram. I'm a board-certified obstetrician gynecologist and also board-certified in what is now termed female pelvic medicine and reconstructive surgery, what used to be called urogynecology. I've been practicing for over 30 years dealing with a variety of female pelvic health and pelvic floor disorders. What's unique about EmpowerRF is that it allows you to treat a variety of conditions, and it has multiple capabilities. So I'm sure a lot of you are thinking, well, will patients really pay out of pocket for these various treatments? I've had the opportunity to practice in Ohio for the majority of my career, and currently now I'm practicing in Orange County, Newport Beach, and in Beverly Hills. And I can say hands down, they definitely will, because the platform does provide an opportunity to address various clinical and therapeutic areas that are really unmet by traditional medicine and sort of third-party reimbursement, whether that be treating the vaginal atrophy and the genitourinary syndrome of menopause, or whether that be a various aesthetic issue that they want to address. So hands down, there is a huge opportunity here, because the majority of women are really suffering in silence. They're not coming forward with these complaints, and they are really happy, almost ecstatic, when you're able to offer them an office-based treatment where there's minimal downtime. They can basically resume things quickly. Another very exciting aspect of this platform is something called V-Tone. Pelvic floor rehabilitation and the patient's ability to isolate their pelvic floor is something that we know is lacking in probably north of 50%, if not more, north of 70% of women. And that's because these muscles are deep muscles. Patients have healthy muscles, but because they're surrounded by their thigh muscles, their buttocks muscles, their abdominal muscles, they can't find them and isolate them. V-Tone is electromuscular stimulation that is done in an office setting that would do everything a pelvic floor physical therapist could do, but you can now control this and have the patient come to you directly for this rehabilitative process. When we talk specifically about who would be a good candidate for this, I'm going to start with conditions that I would term as actual disease states. The first is something called genitourinary syndrome of menopause, more commonly termed vulvovaginal atrophy. And this is basically when a woman loses her natural estrogen that comes from the ovaries. When they pass into menopause, if you will, average age is 50, 51. Within 3 years, 50% of women will develop vaginal dryness, pain with intercourse, irritative bladder symptoms of urgency and frequency. Up until recently, the only thing that you could offer these patients was to replace the estrogen. It has to be done locally. It's messy. A whole slew of women can't take estrogen. Breast cancer survivors, it's contraindicated. Patients that have had blood clots, patients that have headaches, migraine-type headaches. Lots of women, for concerns and fears, don't want to take estrogen. So to have a non-hormonal therapy for this is extremely beneficial for women, and women resonate very, very well with this. Another therapeutic area is the area of bladder or urinary incontinence. And again, RF radiofrequency has had a long history of being a therapy that is offered for incontinence, but because of the microneedling that is now occurring, we're providing an improvement in that connective tissue that is much more robust than traditional radiofrequency that is just bulk heating to the area. The device allows the needles to penetrate up to 3 millimeters, and that's going to really generate all the things that you do to improve the strength and the support of the periurethral tissue. We're also seeing tremendous improvement in the overactive bladder aspect of incontinence. And again, The mechanism of action here is not entirely clear, whether it's an improvement in their pelvic floor or whether it's that heat potentially at that level of invasiveness of 3 millimeters is actually doing something to modulate nerves that control the bladder, etc., etc. We've got ongoing trials in all of these areas, what we term stress incontinence, what we term mixed incontinence, which is overactive bladder, and stress incontinence and overactive bladder. And it's important to understand that a lot of these patients, first of all, don't want surgery if they're surgical candidates, and that would be more the stress incontinence patients. The overactive bladder patients this isn't a surgical condition. You're talking about medicines that are very expensive, that have a lot of side effects, and if they fail those, you're talking about something like a neuromodulator, which is very invasive, a lifelong therapy where you have something modulated that modulates your nerves, or Botox injections, for example, that need to be done every 6 months. So we're studying all of this, and hopefully over time we'll provide you with the best candidates for this. But again, the preliminary success that we're seeing is extremely encouraging in those areas. And then finally, these postpartum patients that are at high risk for developing pelvic floor abnormalities, that maybe have had some, separation of their rectus muscles. This is a platform that, again, they're going to be very, very attracted to because it will rehabilitate their pelvic floor with the V-tone. If they're breastfeeding, they're great candidates because they really can't take estrogen. If they're breastfeeding, they're great candidates for the Morpheus V. And they do very, very well. And we know that if you're able to rehabilitate someone's pelvic floor, it's prophylactically successful in preventing a lot of this stuff down the road. In summary, EmpowerRF is very unique, as I mentioned, because it has multiple offerings, therapeutic and aesthetic, that work very, very well. And it provides a lot of opportunities that are just not available with any other platform or really any other traditional intervention.